Hi, it's Tony Verhoeven, and this episode is really a fun one because it was done live. It was done live on a webinar. So what you'll hear is the audio from the webinar. In the front end, I had a bunch of stuff about NAFA as far as kind of a commercial for NAFA. So I did trim that part out. So you might hear that some part of that is missing. Love to tell you more about NAFA, but give us a call or take a look at NAFAHQ.org for all the cool stuff that NAFA is doing. So in this episode, I had a good conversation with Dr. Jeff Siegel from the University of Toronto. And so Jeff is an expert in air filtration from the science side. Jeff's he's done a ton of research on what's effective, what's not effective, and what research has been done with air filtration in IAQ, indoor air quality. So I think you're really going to enjoy this. If you watch this live, you've got a sense of this already. If you missed it, I'm happy to put this out as a podcast. And this is also available for the full recording on our YouTube channel. So go check out YouTube, look up NAFA, and you'll find us there as well. If you've got any questions or you want to know more about the frequently asked questions that Jeff wrote a paper on, you should go check out nafahq.org and then look for the menu item COVID-19. We've got a bunch of resources there. If you're a building owner or facilities operations manager, got some great content for you there. And if you're a professional in the air filtration industry, like a service provider, manufacturer, or distributor, again, also some information there, especially for small businesses and other information about COVID-19 and the coronavirus. So with that, thanks so much for listening and look forward to your comments. If you like the podcast so far, please go to iTunes and rate us. Rate us a 5 if you like it. Thanks so much and take care. Hi, good afternoon. This is Tony Verhoeven, and we're talking air filtration. Let's go ahead and get started and then reintroduce Dr. Jeffrey Siegel, who is at the University of Toronto. Again, thanks so much, Jeff, for joining us.
Yeah, thanks for the invitation to be here and look forward to the conversation.
Excellent, excellent. So what I wanted to start with is let's dive right into the FAQs. You wrote this paper. In fact, if you go to our website, you can download this from the handout section. But one of the things we wanted to really talk about and focus in on is that if you were a building, first of all, if you're a member of ours, and obviously you know a lot of this stuff, but this is kind of maybe some messaging to help your clients help. But if you're a facilities manager, a facilities operation manager at, a university, a college, a school, a hospital, what would you tell them if they're listening right now? What do they need to know to keep their building safe?
Yeah, absolutely. And, let's have this conversation, at least initially, be very broad and acknowledge that there's lots of different buildings out there with lots of different capacity and other things for filtration. So before we kind of get a little deeper into the details, there are kind of three things I want to kind of put out there that I think are really important as framing for this conversation. The first thing is we're getting a lot of information from our state, our local, our national, or even our international health authorities. And that information is really important. So I see filtration as a part of the solution, but it's something that it comes after we do all the best practices, physical distancing, isolation of infected patients, cleaning of surfaces, all those things that we're told we should do those things. Okay, and then another thing that's really important to say about filtration is that filtration is a tool, and it's one tool that we have in our arsenal, but it's not a silver bullet. And in fact, there are no silver bullets, as we're all well aware of right now. And so it's really important to understand what we're talking about is reducing risk, not eliminating risk. And what we're talking about is trying to do the best we can with what we can do right now. And that would be true if I was talking about lots of other things beside filtration, but I think it's important to say that here as well. And then the third thing that, again, a lot of the people on this call listening already know what I'm about to say here, but that filters are really different from each other. Even the same filter, excuse me, can perform really differently in different buildings. And so there is a really important discussion here that has to happen in addition to talking about filters, about how we use filters and the context for filters. And so I think a lot of what we're going to be doing today is talking about filters, but I'm always going to try and bring the conversation back to that context piece and how they're used. Okay, so that was a little bit of a long preamble, but now let's get to it. So the first message I think that's really important to get across there is something I said already, but I'll say again. You know, filtration has a role here, and how much of a role it has depends a lot on the building that we're talking about. So let's start at the, you know, potentially a relatively simple type of building. Let's say you've got a residence with a forced air heating and cooling system, and you probably don't have a lot of options for your filter. That is, you can put lots of different filters in place, potentially, depending on how your system is designed. But I think that we should be really cautious about assuming that you're going to get very much benefit. And so some of the reasons why I say that, number one is that our residential and our light commercial small systems don't run continuously very often. They cycle on and off as the thermostat calls for heating or cooling. And so even if you have the best filter in the world installed, air simply might not be going through it that often. In my world, we call that runtime, but lots of different names for the same thing. Obviously, air has to be going through the filter for it to make a difference. The second comment that should give you some caution about filters in that type of system is that we have to be a little bit careful, because often we don't install filters very well. And so we pay a lot of attention to something like the efficiency of the filter. But what matters just as much, and in some cases more, is how well is that filter installed? Is there gaps around it? In fact, there's usually almost always gaps around it, but are they big enough? And this really kind of works against filtration in some applications, because if you put in a very good filter with a very high pressure drop, but don't install it well, then all the air is going to go through the gaps. And the fact that you have a great filter won't matter very much. And then the third thing that we really have to think about in almost all buildings with filtration is that there can be a very big difference between the filtration efficiency that's stamped on the filter that comes usually from some standard process, for example, ASHRAE standard 52.2, and how that performs in any given building. And so there's a lot of issues around what's the face velocity of the air going into the filter, those sound bypass and installation issues, as well as a bunch of issues about some filters change in efficiency over time. So they might start off as quite efficient, but then decline in efficiency as they age. And so there's a lot of kind of complexity here on the kind of smaller, let's call them unmanaged buildings. So certainly use a good filter if you can in those types of buildings, but you can't really rely on a lot of protection from that filter unless you have a lot of other pieces in place in terms of the context.
So I guess in summary, you know, when we say what do we need to know about keeping your building safe, and I guess this other question that we had here, kind of on our promotion of the webinar, is can building air filtration protect me from getting 19? Is, I guess the answer is it depends, and it depends on maybe human error or proper installation, right? So if there's a gap and no gasket or a failure of that, I think there's probably some stats on this, but I've heard stats like, you know, if there's a filter that's loaded, or if there's some sort of, you know, bow in the filter, a cardboard filter, something like that, you know, as much as 25% of the air might be bypassing. Is that a fair statement?
I mean, of course, it entirely depends on the context, but sure, people have measured large amounts of bypass, even sometimes when it doesn't look like there's a lot of bypass. And you know, I want to make one small, maybe I could have said this more clearly. I see this less as kind of a failure issue and more as we're trying to use the system maybe for something that it's not fully designed for. And so, sure, we can make systems that work in residences that would make a filter very effective in cleaning the air. But there would be consequences to doing that. There would be cost consequences. There would be energy consequences. And you know, maybe that's a great thing to look at when we're out of this immediate situation that we're in right now. But in the short term, I would say that, you know, unless you have a system that's really designed to take advantage of the filter, again, we're talking about small unmanaged buildings. I think we'll go up in scale shortly. But in those kind of smaller unmanaged buildings, I would suggest some amount of caution.
Right. And maybe in an unmanaged build, you talked about having the fan on or off. Having kind of auto circulation or constant circulation, that's important, right? So if you're just thinking about maybe a residential application, most of us right now, I have my furnace on and it's the blower is only running when it's heating or when it's cooling, and so there's no circulation then.
And in the average American home, that's less than 20% of the time on an annual basis. And so 80% of the time, you could have the best filter in the world and air isn't going through it on average.
Okay. But in a commercial, go ahead. I'm sorry. Finish your thought.
Yeah, I just want to add something. You could say, well, why don't I just run the fan all the time? Sure, it's a little bit of extra energy, but in this context, maybe that's good to get benefit from filtration. And I would say, you know, sure, maybe, but you know, you have to think about a lot of issues. For example, one issue is, do you have a space in the house that where there's an infected or a potentially infected individual? And then running a forced air system can potentially increase mixing and lead to increased infection for others in the space. And so, you know, making the decision to run a fan all the time, a lot of our furnace and air conditioner fans aren't really designed to run all the time. So they might have a higher failure rate. And at a time when we, you know, HVAC emergency work is maybe a lot more expensive and harder to come by. We want to, you know, it's a little bit more careful decision than just saying, hey, let's run the fans all the time.
Sure. Okay. Well, let's talk a little bit more specific, a little deeper about COVID-19 and viruses. And again, you know, practical, like people coughing, right? And so airborne droplets. One of the questions that you answered reads, doesn't filtration require that droplets that cause COVID-19 be airborne? I have heard that it is large droplets. Can you maybe address that in more depth?
Yeah, okay, so this is a great question, and the science is really evolving, you know, by the minute on this. It seems like every day I check and there are more new good articles on this. But the basic issue here is there is many different infection transmission routes. One that we're all hopefully aware of is that there could be large droplets that could settle on a surface, and then I could somehow touch or interact with that surface and then transfer the virus to myself by, for example, touching my face or something like that. And that's a very important route for COVID-19, and filtration probably doesn't have a big role in addressing that particular exposure route. But then the thing we have to think about is that when someone coughs or sneezes or otherwise produces droplets, first of all, some of those droplets are small enough to stay airborne. I feel very comfortable with the literature that's come out in the past few days, as well as what we know about other diseases like SARS that we saw in 2003, which is very closely related, that there is an airborne component. And so some of those droplets are actually small enough that it's probably not even fair to call them droplets, and they can stay airborne for you know, potentially hours or even longer in an indoor space. There's also this issue that is kind of an aerosol dynamics issue, but it's pretty easy to understand. If you think about someone coughing or sneezing, what they're coughing or sneezing, you can think of it like salt water. It's a droplet of water, it's got a bunch of other stuff in it, and then it also potentially has the virus that ultimately leads to COVID-19. And so what happens is, especially for those of us who are still in winter and still heating our homes are relatively dry inside. In fact, our buildings are very dry inside. We all know that. What happens is that droplet very quickly shrinks in size. And it shrinks in size because the water evaporates from the droplet. And so you might have something that you would say, oh, that's a 10 micron, that's a 5 micron droplet. It's not going to go very far. But it does go very far. And it goes very far because even if it wasn't that big, even if it was very large when it first emitted, it's changing in size. And then the other thing is, everyone's got a hobby. One of my hobbies is looking what collects on filters and analyzing what collects on filters. And I guarantee you, and everyone who changes filters for a living knows that there's a lot of really big particles on filters, stuff that's so big you can see it really easily with your eye. And so big stuff does transport over longer distances than maybe perfect idealized conditions would suggest.
Got it. So let's talk a little bit about, now that we've kind of really dove into COVID-19 specifically, I want to make sure that, especially if there's any people who work inside of healthcare facilities, who maybe hear from you on this. So one of the questions, and let's maybe dive into this a little bit deeper as well, is, we know that hospitals have good filtration. Why don't we just all use systems like this? Why don't we just all upgrade? Now that we were in this pandemic, we've never had this situation before. Why don't we just go that direction? Is that going to save us, or what's going to happen then?
Right. So if we had infinite resources, of course, we could address this problem, but we don't have infinite resources. And I think, hospitals are some of the most amazing facilities from an indoor air quality perspective, or certainly certain parts of hospitals. And the thing that really differentiates hospitals, first of all, of course, there's equipment difference and so on. There's a lot of intentional design difference, and that's important. But the really big thing is that there's someone there who's maintaining that and operating that to get maximum benefit. And so what really separates, I think, a hospital from, let's say, a different type of building is, sure, the equipment, but it's really the people and the people who do that work. And so another group of kind of frontline workers, in my mind, in this whole pandemic, are those who are maintaining those systems. And I think that that's a really important issue, and is why we can't simply say, let's put those systems in, even if we had infinite resources in other buildings.
Oh, I'm just muted there. Sorry. So let's talk about those folks that are on the front lines, besides our doctors and nurses that are treating people, but the people that are changing the filters. Right? They're getting up on the ladder, they're going on the roof, they're up in the rafters, where those sorts of things. What sorts of things can they do to keep themselves safe, and what are maybe business owners who are having people on the front lines out there? What sort of things should they think about before they send somebody on site?
Yeah, I mean, that's what really prompted me to write this set of FAQs in the first place, was thinking about that issue. We have a lot of filters out there that may be contaminated right now, and we're going to see more. And in a hospital, a well-managed healthcare facility, there are people who know exactly what to do and know exactly how to change those filters and to maintain the system and minimize the risk to themselves and to other people while they do it. And I think that for the rest of us, we have some issues that we should probably think about. And I have to be a little bit careful here, because I'm going, my usual standard is there peer-reviewed scientific articles on the subject? And this is one that I haven't found articles on. They may be out there, I just haven't found them. And that is, I am concerned about filters having this virus, or in fact having infectious disease in general, and people being cavalier about changing those filters. And I have to admit, there is no, to my knowledge, medical or clinical evidence of this being an issue. But I talk to people who change filters, and usually they have a story about some buildings, some time of the year, they change the filters and they get flu symptoms or respiratory symptoms. Sometimes it's called filter fever. And so my concern right now is that we don't know if this is an important infectious route. But what we do know is that filters are biologically active. I myself have worked on several projects where we've taken lots of bacterial and fungal DNA off of filters. That's widely done in the literature. There's also a smaller set of information, but definitely information out there that suggests that viral, both DNA viruses and RNA viruses like the corona virus are present on filters. Whether they're active and infectious is an open question, but let's be cautious here. So when you change filters, you should change them wearing gloves. You should change them wearing other PPE if you can. You should ideally change them outside if that's possible. So for example, we haven't talked yet about portable air cleaners or other types of air cleaning devices, but if you have the chance of doing it outside where you're not worried about contaminating an indoor environment, that's probably a good thing. So take cautions. I said originally in the FAQs, bag the filter like you saw in the pictures that you showed at the beginning of this presentation. That might not always be feasible, might not always be possible. Depending on how you do it, might lead to increased risk. This was pointed out to someone who saw the FAQs. And so, but the point is, you've got a potentially contaminated filter and treat it as such when you're changing it.
So let's talk about that. You mentioned the portable air cleaners, and I was just going to go into that. I think kind of as a good segue. So you talked about, for lack of a better word, augmentation of a system like, just fans, like getting circulation moving. So what about portable air cleaners? Is that a viable option to kind of augment a system with what's going on right now?
Yeah, so portable air cleaners definitely have a role. And portable air cleaners have a role for several reasons. One is that they can be used for a smaller space, which might be easier than trying to treat all the air. You can put them in a space with either an infected person or a susceptible person. And lots of our buildings don't have forced air systems. Especially again, our residential and some of our light commercial buildings. But, I put all the same cautions in place with filtration and have the same cautions for portable filtration. The idea of a portable filter spans a very wide range of devices. Some of them don't move that much air. Some of them have a lot of bypass issues around the filter. And so let's be really cognizant of the fact that you have to use portable filtration well if you're going to use it. And so that means having a good portable air cleaner, not trying to use it to clean a space that's bigger than it can. You want to be able to think about issues like locating that portable air cleaner as close as possible to either the source or who you're trying to protect. And again, there's no silver bullets here. It can maybe diminish the risk somewhat. And there's actually some good evidence of that, a little bit anecdotal, but evidence nonetheless. And so, sure, they can be used. Sure, they have a role here, but there's no magic.
Got it. Excellent. That's excellent advice. So kind of as we're coming in for a landing here, what other things that obviously you pushed this up maybe about a week ago or so? What other things have you heard? What other questions have you heard maybe that aren't on this list or that maybe you want to address in precautions against the virus, an airborne virus?
Yep. Okay, so I'm going to hit one not very controversial issue and then one very controversial issue. So the not very controversial one first. People have asked a lot of questions about ultraviolet systems. UV systems are, again, a common component of certain types of hospital and healthcare facilities. They come in different types of systems, different forms, and they definitely have a role to play here too. But again, I have to be really clear on some of the limitations. And one of the big limitations is, in order to get benefit from a UV system, it really has to be designed and installed properly for the type of space or the type of system that it's being used in. And so right now, if you were to go to your favorite e-commerce site, you could probably buy lots of different UV air cleaners that you could kind of stick into your HVAC system. And, you know, some of those, maybe even most of those, wouldn't really help you that much because there's not that active design and thought process that has to go into them. So UV systems definitely have a role. They've been shown to be effective in other, not in this particular scenario, but nothing has been shown to be effective yet, just because we don't have the data for COVID-19. But it's reasonable to think that UV systems would be an important part of the component here. But there's that intentionality. You don't start from saying UV is going to work. You start from saying, this is my system. How can I talk to a professional and get a UV in there? Probably, frankly, to help deal with, add some benefit to filtration or humidification or ventilation or any of the other strategies that you're integrating there. Okay, so that's the not very controversial one. The more controversial one is there's a lot of other air cleaning devices out there. I'm sure that many people on this call have heard of them: ionization, ozone generation, hydroxyl radical generation, plasma. And, you know, I'm going to group those devices together, not because they're similar. I know that there's a lot of differences between those devices and how they operate. But the comment I want to make is, you know, I'm a scientist, and part of my way that I do things is I look for independent, peer-reviewed evidence. And that's how I know that something has been tested and evaluated and that someone has given some thought to how it can be generalized. I can read about the methodology and so on. And so my comment on a lot of those kind of alternative air cleaning devices is, I'm all for new ideas. We've got a very serious problem here. I just have not yet seen the evidence that suggests to me that these devices are going to be helpful. And that doesn't mean that they're not helpful. It just means that we don't have the evidence in a form that myself and my colleagues would tend to accept. And so there's certainly a lot of research that's been done in-house or in other contexts on these devices, but what's in the peer-reviewed literature doesn't let us recommend them at the present time.
Excellent. All right, thanks for that. So I think as we kind of are coming to the end of our webinar here, wanted to ask anybody if they want to ask any questions. Everybody should have a questions panel in the GoToWebinar panel there, so you can ask any questions here. I'll be able to see those, and then I'll forward those on, or not forward on. I'll read those to Dr. Siegel at this point here. So go ahead and do that if you've got any questions. If you can't find that, go ahead and put them in the chat, but it's a little easier for me to kind of sort through if you put them in the questions panel. So go ahead and do that now. While we're doing that, I am sharing my screen, and I realized that I don't know if I was sharing my screen in the beginning here. I think I was on pause. So I just kind of went through those slides kind of in the background here, so you were able to see those, but you can also download those from the handouts, and I'll make those available as well. So I'm sharing my screen. We put a few resources on our website for the public, for manufacturers and our members. So if you look at that, you'll see we've actually created a COVID menu item. So if you go to there, hover over that, you'll see the discussion of what we're talking about right now, which is the coronavirus and air filtration FAQs. So those are published on our website there. And then the other, of course, this webinar one will disappear after today. And then the resources for the air filtration industry, which is the page I'm sharing right now. And so what you'll see is there are links to some of the resources that we've created, some resources that ASHRAE has created. And so you can link off to those. You'll see a position page from ASHRAE on airborne and infectious diseases. I also encourage you to go to and download the guidelines from the NAFA guidelines based on those as well. A government response to the coronavirus and especially to OSHA, probably very apropos to what we've talked about with the people in the field out here. And then obviously a lot of people of our members are small businesses, and so you're hurting as well. So we've got a link out to the Small Business Administration's disaster assistance response. And so they've got a special page with a ton of resources and reading material so that if you need to take a small business loan at a low interest rate to help get by in this rough time, that's an opportunity to take a look at that. Or this is an opportunity to take a look at that as well. So please do that. In fact, I probably will respond to everybody who registered for this webinar with these links out to here, especially if you weren't able to watch this live as well. So it doesn't look like we have any questions. I think because we had so many FAQs here, we probably answered a lot of things already. So in the interest of letting people get on with their day, unless we have something towards the very end here, I will just start to wrap this up. So Dr. Siegel, I really appreciate your time and details, obviously, that you've shared today. Anything else that you want to share or anything else that we cover before we close out today?
No, but I do want to say something. And I think, first of all, thanks for the opportunity for speaking today. I appreciate this opportunity as well as, I've received a lot of questions from all types of people all over the world. And I think that, to the extent that there's positive in this situation, I'm glad that those communication channels are open. But I would also like to say, kind of in parting here, that, there is, under the best of times, filtration and HVAC systems are this kind of neglected thing that we don't think about. But I think it is really important. They are an essential part of our response here, not just now in the immediate crisis, but going forward. Hopefully, people will have more of an appreciation for them. And I think it's really important that NAFA members and others involved in those systems understand that they are really appreciated for what they're doing and trying to do the best for their clients and for the occupants of the buildings.
Absolutely. Absolutely. So in closing, whether you are in residential or you're running a facility, you talked about unmanaged building. Let's change that from unmanaged to managed. We're thinking about air filtration probably now more than ever. It's been something you're in your closet or up on the roof or something like that. So think about those. Change your filters. It's better to change your filter more often than have this awesome filter that is never changed, generally speaking, due to bypass, right? So make sure you're doing those. Think about those things. If you have questions about your installation, about your system, all of our members are listed on our website. If you go to our website, click on membership, we list all of our members publicly. There you will see a ton of members that are manufacturers, dealers, distributors, and also other associations like ASHRAE that we link out to as well, and service providers I might mention as well. So please do come to nafahq.org as a potential resources. And if you have questions for Dr. Siegel, I'm sure you can reach out to him as well. Link to him and his page is on our website on that FAQ page. And we look forward to answer any questions that you might have beyond this. Thanks so much for listening. We've been talking air filtration with Dr. Jeff Siegel. Thanks so much, Jeff.
Thanks. Appreciate the opportunity.
Take care, everyone, and be well, be safe, wash your hands. For more information about how the National Air Filtration Association's membership, networking, education, and certifications can improve your career and business, visit nafahq.org.